Okay, my name is Jason, and welcome to what am I calling this? COVID reality. What I'm planning on doing is, I guess, multiple times a week, kind of posting the reality of the situation in this whole COVID-19 pandemic that we're going through. Partially, I would say the reason I'm doing this is I've run into just loads of ignorance. People picking a position that they want to believe and then finding proof in every leftist publication that they can. I actually have a couple of people that I know that are pillars of the community, as they were, and they've embraced this because they don't want to accept that anything is wrong. And the problem is that that's the reason we're in this situation to begin with. Social distancing not being upheld, mask wearing not being upheld, basic ignorance of how the disease works despite tons of proof from the CDC, from independent researchers, from other countries that are dealing with it. We're going to go through all that, not in this particular video. This particular video today, we're dealing with the situation in Houston, Texas, which is where I'm from. And also another part of the reason I'm doing this, and you may hear it in the background if you hear like an ICU monitor beeping. My oldest daughter is a special needs kid. She's non-ambulatory. She has significant neurological issues and other things like that. She's come a long way, but this COVID-19, she would be a primary target, as it were, for not surviving. Or worse, having her legs amputated because of blood clots or just, other things. And I feel the kind of society has run amok due to fear and ignorance and a couple other things. But basically, I'm kind of doing this. If maybe I can do some small part and other people do their small parts, we can stop this. We're already the worst country in the world. Places like China, Japan, Taiwan have beaten us. They beat us on testing. They beat us on keeping the numbers down. That'll be a subject for another time. One thing I want to say before I get started is everyone, I encourage comments. What I do not encourage, I encourage discussion. I don't know everything. I currently have read, like 20 to 30 research papers, well over 150 articles written on coronavirus, after effects and symptoms and just a variety of things, the numbers, and I track the numbers independently, the CDC and the Texas State Board of Health in Harris County. So I've actually become quite knowledgeable in all this, but I'm not even close to knowing anything because then I would cure the thing if I knew everything. So feel free to comment, feel free to post your own evidence, but don't be rude, don't be nasty, don't, you effing idiot this or whatever. Like, no, none of that. You want to discuss, let's discuss. If I have something that I don't know that you know, I want to know it. And then I'll put it up here and I will give you full credit for bringing it forward, because this is about first and last stopping this thing, saving people's lives through information. So let's get started. The particular chart you've been seeing here while I'm yammering away is the Texas Medical Center website. Their statistics on their COVID population in the ICU by breakdown. You can access this yourself. I'll try to post the link in the YouTube channel. But let me go ahead. I had a lively discussion with some people I know. And basically, they sent me a video, which I will also, a news story, I will also link to, from Channel 11 KHOU TV in Houston, which is a channel we sometimes watch. And they broadcast a review, and they talked to some CEOs at the TMC and other, a doctor or two here and there, public health official. So some of the things I'm going to read here are quotes from the story itself. So we're just doing this now, and you can see this on this chart. According to the TMC CEO, the following things were actually said. And please bear in mind, this is my first video. I'm learning the ropes. So their ICU is divided into three phases. Phase 1, which you'll see at the bottom in blue there. Phase 1 is the base level of ICU, the most basic level. And that level is almost full. If you can see on the chart, and when you follow the link, you will see that Phase 1 is 97% full. And 35% of those are COVID-19 patients. So remember, the ICUs are also open for everybody else who needs ICUs. That's part of the big problem here. Okay, so then it's also broken down. They're phase 1. So phase 2 and 3 are respective. They're in different colored blues going up. So there are, and this is part of the quote, there are hundreds of beds left in phase 2 and 3 before we reach a crisis, is what the CEO said in the story. So the representative. So the issue I have here, main issue. So when they speak in abstractions. We have hundreds of beds. How many hundreds does it take? 200 is hundreds. That's 200s, 100s. Is it 200, 300, 400? How many? Now, as you can see here in the chart, they do have some rudimentary numbers to the left side there. Remember, this wasn't mentioned in the story, the link I got independently, but we're supposed to have an overflow total capacity, surge capacity of 2,200 beds. That's from multiple sources. I can go into that in another video. But anyway, they don't specifically mention it in the story. They're just reassuring us there's hundreds of beds. So that's kind of a problem, because the city of Houston has something like 4 or 5 million people. I'll double check, and if I'm wrong, I know it's probably even more than that. So even 900 beds is not that impressive. It just really is not. I mean, even a fraction of the people need the ICU. Okay, so not that impressive. Also, if you notice in this chart, phase 2 and phase 3 are not empty. This reporting is at the time of, let me move my mouse. There we go. And I will adjust this real quick so you can see. Sorry about that. I blotted out the date, I think. Yeah, June 29th, yesterday, not today, June 29th, as of reporting. If you look at phase 2, which is in that powdery blue in the middle there, if you look to the right side, you'll see the total ICU bed occupancy is 76%, with almost 27% being COVID patients. And if you look at phase 3, they're at 59%. Well, you have phase 1 at 97, you have phase 2 at 76% capacity, and phase 1 at 59. How are there hundreds of beds? See, here's where I come into the problem. There may be 200 beds available, and that would be hundreds of beds, or 300. That's not leaving us much room. Okay, so that in and of itself is a problem. So again, I'll post that link so you can get a better look at it, and you can keep track for yourself. Let's see here. So it also shows, it also shows the bed allocations. Yeah, and I already went over that. Okay, so more story quotes here. This is directly, almost verbatim. Of concern to doctors is the positivity rate. So that positivity rate is the rate of how many people test positive. Okay, if the rate continues to climb, then the number of beds will be a serious concern. Okay, so that's exactly what they said. Okay, so it's like, okay, we have plenty of beds, but if the rate keeps going, we'll do that. Also, one of the quotes was that we're not in any imminent danger in the next 2 weeks. COVID's been with us since January. Oh, well, February, actually. Well, officially, or whatever. 2 weeks is not going to buy us anything. They're also very concerned because the even bigger... Okay, so we're very concerned because even the biggest medical city in the world has its limits. That would be Houston. And so that's another CEO talking there. So back to my point, Texas in general is setting records for positive cases. I think it's been almost 2 weeks that we've had, like a week and a half, that Texas has set a daily record. And Houston for sure has been almost right at 2 weeks. It's more and more each day. Okay, so Houston's been doing that. So here we've already had 2 weeks of climbing, and the virus is not stopping because they're not shutting things down. They kind of just rolled back a little bit on their plan, and on their opening plan. So the problem here becomes that it is going to continue for at least the next 2 weeks. So then what does that mean? They've admitted that we have a problem. So you can see there's a lot of problems here. And also, expanding ICUs is not the easiest thing in the world. You can do it, but you can't just turn any bed into an ICU bed. The problem is that we have politicians trying to calm us down, but at the same time, we're being told things like Governor Abbott and Vice President Pence the other day were like, thanks to the diligence of your governor and to the great work by Texans that we've done this. Well, no, that we have been doing great work. I go out a lot because I have to work, and I see just maybe, if we're lucky, 25% of people wearing masks. I mean, this is a major issue. We're sitting at the precipice of just a terrible, terrible, terrible fall, and there's no end in sight. And add to that, coronavirus is not going anywhere because it's already summer and it's actually raging. The fall will be worse because that's when studies have shown that the other coronaviruses that cause the common cold and pneumonia they favor that season, and coronaviruses in general like to operate in the cold. So it's going to be a lot of different things. I just wanted to bring up these facts and figures. I will post another video soon concerning other things we're going to talk about remdesivir. We're going to talk about really how close we are on an actual vaccine, how how this has turned into a year-round thing. We're even going to touch on things like the Spanish flu, which really did not originate in Spain. Just tons of stuff. So ask your questions, stick around, post links, just be respectful to yourself, others, and me. And let's see if we can educate a lot of people and actually maybe make a change somehow.